It was started in early 1960s by the Franciscan Sisters of St. Anne from Netherlands. Also started just with a small section of outpatient and maternity. Then after that they started the MCH and the child. About patient, inpatient, maternity, laboratory, PSC, X-ray. We are also having feeding program for the malnourished children. Okay, meds is our major supplier of drugs. I think 90% of the drugs we use here come from their price is fair and they have quality drugs. Before they sell to us the drugs, they must be tested and proven that they are of good quality. Apart from that, they are also giving us training. So Terre des Hommes also support us in paying some of our staff, purchase of some drugs. The feeding program we are having, they are the ones responsible for this food and even for the capacity building of the staff and even of the board. Another partner, CAP is Kenya AIDS Response Program. Kenya AIDS Response Program is coming in as a support from the US government. We have also community health workers who are attached. Every client who is here is attached to a community health. Because even if, say, a client dies, there's the responsibility of the community health worker to notify us that this client, but we also have people who are assessing us, like the American government. They are giving us their money. And they want to find out, are you using our money according to our agreement? We have an MOU with them. So they must make a follow-up to see that their money is used the way it is expected to be used. So last week, we have an AGM for all the faith-based facilities in the country. And they were checking on different areas, finances, management, clinical services, name them. And we managed to scoop 3 CAP being the best in management, finance, and clinical services. We have the CAPs here with us. For Nyanza and West, and they found that what they were looking for is true to give them this.
I'm Monica Ojenge. I come from Mahaya sublocation, but this is my hospital where I do the visit. I'm an HIV positive. From knowing that I was positive, I came to this hospital and the doctor received me because I was open to them. So I started on Septrin. Now I'm on ARVs. I get them monthly without payment. And from there, I'm also a social worker. I do the visits. So I encourage people to know their status, because when I give them an example, you see how I am. I'm an HIV positive. I can do everything. I have strength. I have good life. But that does not mean that I'm not positive. I'm positive and I can do everything as any other person. So the hospital has really helped me to manage my life. And I know if I was to buy the drug, I could have not afford. Just through the goodwill of those people who are helping us, that they make us to live. It is really helping people because it has trained the community health workers, and so the community health workers go outside actually to sensitize the community on the stigma that is still around within the people. The services, I think it's now the drugs free of charge, and then there are those who they say that their weight is not of that good health. They are given some flour to go and make some porridge to boost their immunity. They provide a lot. In fact, you see, like the side of the children, they get free treatment. You see, like sometimes people might think that this is a private hospital, they can't get that treatment. But the children under 5, they get that, and the immunization is taken care of freely. We don't have a theater, but they are recommended to other hospitals like Kisumu, Nyanza, sometimes Bondo.